closely at this portrait. The freckles scattered across this boy's face are a common, harmless trait. In medical terms, though, every single one of those freckles is classified as a skin lesion. A skin lesion is simply any patch of skin that looks or feels physically different from the healthy tissue immediately surrounding it. If you've ever had a pimple, a scratch, or a rash, you've had a skin lesion. Virtually every human being experiences these everyday, non-cancerous marks at some point. But this chart shows a much more serious statistical reality. Exactly 1 in 5 people in the United States will develop a cancerous lesion, skin cancer, in their lifetime. Distinguishing a harmless blemish from a deadly threat requires learning how to read the skin, categorizing marks using a specific set of physical characteristics. When a dermatologist examines an abnormal patch of skin, the very first step in their diagnostic tree is determining if the mark is primary or secondary. A primary lesion is the skin's immediate, direct physical response to a specific trigger. That trigger could be genetic, a bacterial infection, or an allergic reaction to something you touched. This diagram shows how primary lesions physically present on the skin. On the left is a perfectly flat patch, or a macule, where the skin structure remains level but changes color. On the right, the tissue structurally alters into an elevated, solid bump, known as a papule or a nodule. Sometimes those elevated primary lesions fill with fluid. Depending on the underlying cause, these form blisters containing clear liquid or pustules filled with white pus. You see primary lesions all the time. Acne breakouts, the birthmark you were born with, and the sunburn you got at the beach are all common examples. These marks represent the baseline physical reaction of your body's largest organ. Having a primary lesion does not automatically indicate that you are in danger. The second branch of the diagnostic tree involves secondary lesions. These occur when a pre-existing primary lesion physically evolves or degrades over time. This evolution is usually triggered by mechanical trauma. If an allergic rash itches and you scratch it, you are physically damaging the primary lesion. Sometimes it happens naturally as the skin attempts to heal itself over several days or weeks. That physical trauma produces new surface-level features. The skin might break apart into flaking scales, form dried crusts from leaking fluid, or leave behind a raised scar as the tissue awkwardly mends. In more severe cases, the structural breakdown goes deeper. The tissue can split into painful, narrow cracks known as fissures, or erode completely to form open, scooped-out sores called ulcers. For a medical professional, a secondary lesion acts like a historical timeline. By examining how the skin has broken down or scarred, doctors gain crucial context about what caused the initial injury and how long the tissue has been struggling to recover. Once the physical structure of the lesion is identified, doctors apply the final, highest-stakes diagnostic filter, determining if the mark is benign or malignant. Benign lesions are non-cancerous growths. They pose no threat to your overall health, and unless they are physically bothering you or you want them removed for cosmetic reasons, they require zero medical intervention. Malignant lesions are skin cancer. These are aggressive, abnormal cellular growths that carry severe, potentially lethal health risks if left unchecked. This graphic illustrates the precise visual metrics dermatologists use to spot malignancy. A key warning sign is rapid, observable change. If an existing mark suddenly becomes asymmetrical, shifts its color, or alters its texture, the cells are behaving erratically. The ultimate behavioral red flag for skin cancer is an open wound or sore that persistently refuses to heal over an extended period. Spotting a lethal threat requires active observation. The most dangerous lesions reveal themselves through their ongoing structural mutations. While genetics influence your baseline risk for these mutations, your environment plays an enormous role in whether a harmful lesion actually develops. Intense, unprotected exposure to the sun is a leading trigger. It causes both the immediate tissue damage of a sunburn and the long-term cellular damage that drastically elevates your malignant risk. The most effective preventative measures you can take are applying sunscreen regularly to block that radiation and strictly limiting any intentional tanning. If an aggressive, malignant lesion, like melanoma, goes untreated and grows deep enough to reach the lymph nodes, the survival rate drops drastically. Fortunately, your skin functions as a highly visible early warning system. By monitoring the canvas of your own body and asking a doctor to examine any unhealing changes, you give yourself the strongest possible chance at an early, successful cure.